Hello and welcome to the topic Sarcoidosis in the module of Respiratory Medicine. By the end of this module, you should be able to understand the disease sarcoidosis, outline the clinical presentation of sarcoidosis, summarize the investigations done to establish a diagnosis, and assess the severity of the disease, formulate a management plan, and outline the prognostic features of this disease. Let's get started. Sarcoidosis is a multi-system inflammatory disease of unknown etiology that predominantly affects the lungs and the intrathoracic lymph nodes. This condition is manifested by the presence of non-caseating granulomas in affected organ tissues. Presentation varies with the extent and severity of organ involvement. Patients may come in asymptomatic, or there may be systemic complaints such as fever or anorexia. And most of the time, patients may have pulmonary complaints such as dyspnea on exertion, cough, chest pain, and rarely hemoptysis. Majority of patients are asymptomatic, especially during the early course of the disease. Some may develop exertional oxygen desaturation and crackles may be heard on auscultation. About 30 to 60% of sarcoidosis patients develop intraocular inflammatory signs and bilateral granulomatous uveitis. Cardiac manifestations include heart block, sudden cardiac death, and ventricular arrhythmias. Neurologic manifestations are rare. Cranial nerve palsies, hypothalamic pituitary dysfunction may occur. Now, let's look at the various clinical syndromes of this condition. Löfgren syndrome. Löfgren syndrome is an acute form of sarcoidosis characterized by bilateral hilar lymphadenopathy, erythema nodosum, fever, and polyarthralgia. It typically occurs in young females and carries an excellent prognosis. Hereford syndrome. This syndrome is a subset of sarcoidosis. There's a combination of parotid enlargement, fever, and anterior uveitis. And Mikulicz syndrome, which is the enlargement of the parotid and lacrimal glands due to sarcoidosis, tuberculosis, or lymphoma. Chest X-ray is key to diagnosis. Outlined in the slide is the staging system used to classify the extent of the disease. Stage 0 means normal chest X-ray findings. Stage 1 refers to bilateral hilar lymphadenopathy. Stage 2 refers to bilateral hilar lymphadenopathy and infiltrates. Stage 3 shows infiltrates alone, and Stage 4 means fibrosis. Sarcoidosis mainly causes hypercalcemia through forming increased concentration of calcitriol, the active component of vitamin D. This is as a result of increased activity of 1-alpha hydroxylase produced by sarcoid macrophages. Serum ACE levels may be elevated as well. Serum ACE levels are elevated in 60% of patients at time of diagnosis, and this correlates with total body granuloma load. Most patients require only symptomatic treatment with NSAIDs. Those with extrapulmonary disease and persistent pulmonary disease will need treatment. Corticosteroids are the mainstay of therapy. Indications for steroids are patients with chest X-ray stage 2 or 3 disease who have moderate to severe progressive symptoms. Patients with asymptomatic and stable stage 2 or 3 disease who have only mildly abnormal lung function do not require treatment. Patients with hypercalcemia may require corticosteroids, and the other indication for corticosteroids are eye, heart, and neurologic involvement. Sarcoidosis remits without treatment in approximately 2/3 of people. Factors associated with poor prognosis include insidious onset with symptoms more than 6 months, absence of erythema nodosum, extrapulmonary manifestations such as lupus pernio and splenomegaly, chest radiograph showing stage 3 to 4 features, and people of African descent. On the other hand, factors associated with good prognosis include HLA-B8 and Löfgren syndrome, which refers to the presence of bilateral hilar lymphadenopathy, erythema nodosum, polyarthritis, and fever. In summary, sarcoidosis is an inflammatory disorder which affects multiple systems in the body and forms a non-caseating granulomas in its disease course. It predominantly affects the pulmonary system, bringing about respiratory complaints. Chest radiography staging system is used to stage the extent of the disease. Although many do not require treatment, those with extensive disease based on the chest radiograph and clinically plus systemic involvement of the disease will require treatment which is corticosteroids. We have come to the end of this module. Thank you.